Our today's topic of discussion is pathology and risk factors of myopia. There are distinct pathological signs that are associated with high myopia. Dilated fundus examination may reveal various pathological changes in the posterior pole including, myopic crescents, Fuch's spots, pigmented, circular lesions secondary to subretinal neovascularization and hemorrhage, exudates, posterior staphyloma, retinal breaks, scarring and retinal detachment. The optic discs may appear flat or tilted. The vitreous may also be affected with opacification, liquification and detachment. Cataracts and open-angle glaucoma are also risk factors of high myopia. The ocular pathology that is associated with high myopia is not generally observed with isolated physiologic myopia. In 2003, Luo et al. Used optic coherence tomography (October) to study the association of macular volume and thickness with refraction and axial length. The study included 104 Chinese school children with refractions between +1.00 to -4.5 diopters. After controlling for gender and age, the authors found that increasing axial myopia was associated with reduced macular volume and parafoveal thickness. The authors suggested that October may be a useful tool for determining early macular changes in physiologic myopia. Many studies have investigated the heritability of parental myopia associated with physiological myopia. Numerous studies have shown a higher rate of myopia in children with myopic parents and an even higher risk for children with two myopic parents. Many studies are confounded by strong environmental factors, and research has shown that associated parental heritability could be the result of shared environments rather than shared genes. Moreover, investigators have also shown variation in the prevalence of myopia for individuals of the same racial or ethnic group in different geographic locations. In 2008, Rose et al. Compared the prevalence and risk factors of myopia in children of Chinese ethnicity in both Sydney and Singapore with inclusion criteria that required both parents to have Chinese ethnicity. The prevalence of myopia in children of Chinese ethnicity was significantly higher in Singapore 29.1% than in Sydney 3.3%. There is a general agreement that physiologic myopia has a multifactorial etiology with both genetic and environmental influences. Environmental factors including near work, accommodation, accommodative lag, spectacle correction, intelligence scores, urbanization and diet have been investigated for their role in myopia and myopic progression. Many studies have reported a correlation between near work and increased myopia, however the association is usually weak and the data tends to be confounded by other genetic and environmental factors. A large study in 2008 by Ip et al. Suggested a correlation between high-intensity near work and increased rates of myopia. The authors showed a minimal correlation between hours spent engaged in continuous reading and parental reports of close reading distance with increased myopia. Time spent doing homework or time spent doing near activities did not show a correlation. In fact, time spent playing handheld console games was associated with a more hyperopic refraction in crude analysis. This data suggests a link between near work and myopia but does not conclude a causative relationship. A number of studies have looked at computer use and myopia and found no significant correlation. Accommodation is a significant covariant of reading and near work, and as a result, several studies have focused on the association between accommodation, accommodative lag and myopic progression. A study in 2004 by Guiazda et al. Demonstrated that children with higher degrees of myopia also had increased accommodative lag, 16. The children enrolled in the study were already myopic, and although a correlation between myopia and accommodative lag can be assumed, it does not represent a causative relationship. More recent studies have shown opposite results to those of Guiazda et al. In 2006, Muddy et al. Showed no changes in accommodative lag prior to the onset of myopia. Moreover, accommodative lag was only documented in children after the onset of myopia. The authors speculate that accommodative lag may be a consequence rather than a cause of myopia and is unlikely a predictive factor. This was further supported in 2008 by Weizhang et al., who showed no significant relationship between accommodative lag and myopic progression. There are numerous multicultural studies that have shown higher intelligence quotient (IQ) scores in children with myopia. Although the causal relationship has yet to be determined, it is hypothesized that ocular axial length is directly related to cerebral development. It has also been speculated that similar genes influence both IQ and myopia. Seong Mei et al. Studied 1204 children in Singapore to determine the association between intelligence and myopia. After controlling for age, gender, parental myopia and education, and books read per week, they showed that children with higher IQ scores had significantly more myopia than those with lower IQ scores. The authors suggest that nonverbal IQ may be an independent and stronger risk factor than increased reading books per week. In 2008, a similar study was performed in the UK on 6,871 children, and after adjusting for ethnicity and parental myopia, a strong correlation was shown between higher performance on school-based standardized tests, verbal IQ and risk of myopia. Evidence-based research has shown a strong correlation between increased intelligence scores and risk of myopia, but the reason for the association has yet to be determined. There are several studies that have reported urbanization as a potential determinant of physiologic myopia. Many studies that have shown an association between increased myopia in urban areas as compared to rural areas are confounded by variables such as level of education, IQ, socioeconomic status, near-related activities and outdoor exposure. In 2008, a Polish study of 2,206 students found that children living in the city had a two-fold increase in the rate of myopia when compared to children living in rural areas. Although they were able to show a correlation between urbanization and myopia, the authors did not control for the above-mentioned co-variants, and a causative relationship cannot be assumed. There is controversy in the literature as to whether ambient light while sleeping is a risk factor for developing myopia in young children. In 1999, a study published in Nature by Quinn et al. Investigated the effects of ambient lighting on refractive development in 479 young children. Parents of children admitted to a pediatric ophthalmology clinic were given questionnaires on the child's nighttime light exposure. The authors found an association between night light exposure during the first 2 years of life and the development of physiologic and high myopia. They reported a dose-dependent risk showing an even higher prevalence of myopia in children who slept with room lights on before the age of 2. This article has been the subject of debate, and with many researchers questioning the validity of their findings. A similar study in 2003 was performed in the UK, where parents of 122 university students answered questions on their child's artificial light exposure during the first 2 years of life. The study controlled for a number of variables including parental myopia and showed no significant association between nighttime light exposure and myopia. Conversely, they found myopia was more common in children who slept in darkness during infancy, although the data was not statistically significant. There is currently no consensus on whether ambient nighttime lighting during early childhood is a true risk factor for myopic development. Although several studies have investigated the effect of diet and nutrition as environmental determinants of myopia and myopic progression, there are significant inconsistencies in the results. A recent study in 2010 by Lim et al. Evaluated the association between myopia, axial length and dietary factors of 851 Chinese children using food frequency questionnaires. After the authors controlled for age, gender, body mass index, socioeconomic status, parental education, time spent outdoors and books read per week, they found that higher saturated fat and cholesterol were correlated with longer axial lengths. They did not find a significant association between myopic refractive error and any other nutrients analyzed.